Go for it.
All right, we're talking about women's wellness tonight with Dr. Dow. Thank you everyone for joining us. Sorry for the delay. It's Thursday, September 10th. We're happy to be with you. Can't believe it's actually September, first of all. So amazing where this year has gone by. And I think tonight is a very important topic as where the year has been, in addition to we're going into fall, oddly enough, and we're talking about immunity. So we want to know from Dr. Dow tonight what happens when our immune systems go awry, out of whack, too strong, too weak, out of balance is what Dr. Dow has taught me about balance in the immune system. So Dr. Dow, with that said, to get started, would you please explain to us the foundation of immune systems and how balance is so important?
Well, our immune system can be kind of parceled out into two parts. And one we call the innate immune system. And the other one is called the adaptive immune system. An innate immune system is a part of our immune system that automatically takes care of things without thinking. So for example, you got bacteria running into our body. And your body automatically figure out and kind of pinpoint, oh, we got to get rid of that bacteria. So it sends out armies of maybe white blood cells or neutrophils and trying to get rid of bacteria or viruses, neutralize them, okay? Then you have the adaptive. Adaptive is a situation where that the body may not have seen this virus or bacteria before. And adaptive trying to adapt to what is seen and try to change the way it works with that virus and bacteria. So you have the innate and you have the adaptive, and they kind of seamlessly work together. A lot of things that we are learning about immune system right now is, I cannot believe COVID-19. COVID-19 really are teaching us so much about the immune system. I think almost every person on the planet now, it's like an expert on the immune system now, because we hear so much of it. We hear about the first exogenous attack, how our body is reacting to the virus, getting fevers and getting shortness of breath and cough, body ache, even, symptoms, stomach symptoms such as nausea and vomiting, etc., diarrhea. Then on the other side of it, we call that phase 2, the exogenous attack, our body reacting to the virus at a very, very beginning when the virus is just attacking. And then you go to the second phase where that the virus now has stimulated or initiated our body's own immune system surges. We call that cytokine surges, where our body is starting to create inflammatory activities to help to work and neutralize viruses. And so that's kind of like a phase 2. And then phase 3 is if it goes awry and if it doesn't get better or our body doesn't get it in control, and that's when we start having damages. And we start to get, especially for example, the SARS-CoV-2 type of virus can create clotting, for example. So we start to see clotting issues. And so those are kind of things that we see. And of course, the fourth stage, if we don't get this all clean out or managed, then we're gonna start to see damages to the organs, to the nervous system, and even the brain cavities. And so immune system is this wonderful system in our body that has a certain balancing act. Because if the immune system is too weak, then we cannot fight the exogenous vectors. So for example, bacterial virus. If it's too strong, then it can damage our own tissues because it starts to target and start to pinpoint our own tissue as enemies. So we start to attack ourselves. And that's not something that we want either. So there's a very good reason that we want to see our immune system to be as balanced as possible. And so to have a balanced immune system, we're talking about basically having a good health. If we are in a good health status, then we might be able to neutralize virus or fight bacterial infections much better. even if we have to use medication, using the medication does not mean that our body is going to stop start fighting itself. Okay, so it's very important to understand that we need to have our immune system to be strong, that we cannot just rely on antiviral or antibacterial or dexamethasone. Okay, so we need to help our body to be strong, to be balanced, so it can fight the disease in the most balanced fashion.
So, Dr. Dao, there are some people that I know personally that get sick every year, all the time. And then there's people that I know, quite frankly, like myself, that never get sick. I haven't been sick in probably 5 years. And there's things that I do in addition to obviously Chinese herbs, but there's other things that I do to support my immune system. What are some of the things that are just really simple from the day to day to help support our immune systems over the entire year, not just during cold and flu season, or for example, right now we're in COVID season, so to speak, which is new for all of us. But what are the things that you can recommend? And then we can dig deeper from there.
Well, I think I have spoken about this before. What I often say, the 3 S's, okay? The 3 S's. The first S is sleep. Having a good, sound sleep, it's going to help a long way to make sure your immune system is strong, okay? So not having a good sleep is going to shortchange your body's ability to restore and rest. Therefore, your body is not able to fight as well. So I think the very first thing has to be sleep. Having a good sleep hygiene, I think that's very crucial. If you are somebody who don't sleep well, I think it's very important for you to see your healthcare practitioner to find ways to see if we can address your sleep issue. That's number 1. Number 2 is, the second S is stress, okay? So stress is good for our body when it's moderate, when it's appropriate amount, when it's stable. Stress can be actually stimulating for our immune system. But when stress is overboard, when it's too much out of balance, sharp, damaging, or emotionally taxing, then it's going to drain our energy and make us compromise in our immune system in fighting, because the energy that's used to deal with stress is the energy that's taken away from our immune system. So that's the second S. The third S, I often say sugar. Well, what it means is your diet, okay? So if you're eating a lot of added sugar, if you're drinking a lot of alcohol, by the way, alcohol is just another form of sugar. These are what we call pro-inflammatory foods. So what that means is that when your body is not in a very balanced state, then it's very easy for sweets, for sugar, for alcohol to create pro-inflammation, cause inflammations. And that obviously, when your body is inflamed, then its ability to respond to any kind of attack from the outside is become inappropriate, either too much or too little. And so I think diet is crucial, to eat regular meals, 3 meals a day, and try not to, unless you're going through a detox or weight reduction program and supervise. Otherwise, you should really eat 3 square meals a day, eating clean foods, organic if it's possible, and have a good balanced diet of grains, vegetables, and protein, making sure that you deal with food allergies or dealing with any kind of food sensitivities. If you have IBS, irritable bowel syndrome, get a repair, get it better, using food enzyme, maybe even using probiotic, or see somebody for acupuncture treatment or herbal treatment, or see a physician to deal with the, for example, IBS situations. I think that's very important. Digestion is key, so diet is very important. So that's the third S. So when you ask me a question, those are the 3 things I would say that's fundamental. If those things are not good, you know, you can take tons of vitamin C, You can take tons of vitamin D. You can take zinc. Ultimately, they are not going to work that well in helping you to fight diseases.
I know, so you started talking about vitamins a little bit, so let's stay on that topic for a minute. So you said you talked about C, D, zinc. I know in past just few years, like elderberry has become really popular. And I'm talking like outside of, I mean, Chinese medicine in this arena is extremely important, and we'll get to that. But for some people that need things that are a little bit more accessible, like you mentioned some vitamins, tell us what you know and understand about elderberry and how that can help support the immune system.
Well, we do know that elderberries has been known to boost immune system. Its strength is the ability to actually reduce cough. And it's been known for, if not hundreds of years, in Western medicine, herbal medicine, that has been used to deal with bronchitis, dealing with respiratory infections and influenza. And so the elderberry seems to be effective and helpful for those kind of conditions. So that's, for example, that is something that you could definitely get. Again, go back to things like vitamin C. A lot of time people can go, you can take anywhere from 1,000 to 4,000 cc, 4,000 milligrams of vitamin C. And that could be very helpful. You just want to be careful that, you know, these kind of things might give you a little loose stool. And the other thing is vitamin D. Nowadays, we often say minimally using about 2,000 milligram, 2,000 IU, international units of vitamin D, can be very, very helpful also in reducing the cold and flu occurrences, as well as shorten its the length of the disease itself. I think as evidence mounts, I think there's two, vitamin C and vitamin D has a very good clinical, shall we say, very good clinical evidence. Others, it's not as strong, but at least vitamin C and vitamin D is something that you could use. And zinc is another one that seems to be very helpful also as well.
Okay. And yeah, there is a lot of conversation about zinc right now, particularly with COVID. You hear that a lot. People taking more zinc or looking for zinc. I mean, honestly, if you go to the store, a lot of these vitamins that you're talking about, you can't find. So definitely people are trying to load up on them.
Right.
What about in terms of immunity? What about gut health?
Very important. I was going to get there because the truth is, you have to understand that your immune system really originated from your guts. Okay, so it's your microbiome. Your microbiome is a mixture of different bacteria. Okay, different bacteria, different strains of bacteria. That is key to assimilate and understand and coordinate with the bacteria or viruses from the outside of our body. When the food comes into our body, our microbiome, which is composed of healthy bacteria, along with our food enzymes, helps to break down the food particles. But not only that, it also helps us to break down harmful bacteria, harmful viruses. So the microbiome is absolutely the first defensive system, with especially the things that you eat. So in the sense that if we have a poor digestion, then it's much easier for us to get sick. Okay, so I said it earlier before. If you have irritable bowel syndrome or symptoms, it's very important for you to find a practitioner who can help you to restore your gut health. And what that means is that less gas, less bloat, better digestion, less fullness, better appetite, and also a more regular bowel movement. Okay, so these are kind of things I consider it to be very normal and very important to have.
We're going to talk about poop again, huh?
I'm into poop, no problem. Poop is very important. And you know, there was a period of time where we talk about poop transplant. There are people who has lost their microbiome, and so they actually take a healthy person's poop and transplant it into the unhealthy person's intestines to restore microbiome.
No, 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 no. No, no, no.
Well, it seems to work quite well for
I'm
some
sorry,
of
there
these
has to
things.
be other ways. We all have to have really good preventative measures way before that. Like, that's extreme. No,
I
no.
agree. I agree. I think there are natural ways to treat our microbiome first before we go to that extreme situation.
Um, so, as we continue to talk about immunity, I know that immunity and immune response, our body's response, changes as the decades go by. Now, that's not necessarily the case for everyone, because you could have a younger person that isn't particularly healthy. Maybe they have they're overweight. Maybe they have a history of diabetes or in their family, heart disease, all kinds of things, right? That can affect the immune system. But particularly for people as we age, our immune system becomes, less responsive, and it takes a little bit more work to keep it up. So what can you share with us in terms of just as we're aging? I mean, obviously the things we're talking about are important for everyone at any age, but I would think that there are things we need to do more as we're getting older. Just, even thinking about my parents who both come to see you on a weekly basis. I know you're doing different things for them than you necessarily would do for me, because they're in their mid 70s. And so what can you share with us about that?
Well, first of all, as we get older, it's actually very important to get rid of symptoms that plagues you. So for example, you might have some sinus congestion. You might some have lower back pain. You might have some headaches. When we were younger, normally we just kind of bulldoze through it, okay? Because our youth, a lot of time we bulldoze through it and it just doesn't come back, right? Well, in the older population, you can't bulldoze anything as well. They stay with you. So in those situations, you want to treat them right away. You want to take care of them because any of these symptoms can become a drag, become a burden on the body. Is using resources that your body don't need to use resources on. And therefore, your body can put the resources into strengthening its immune system. So for example, in this country, in the United States, we often see people who are overweight, okay? So overweight can be an issue, can be a drag on our immune system. Sometimes it actually go the opposite. Sometimes cause our immune system to be hyper-functioning, hyperactive. So then you're gonna invite autoimmune diseases and you can invite poor inflammatory responses, a lot of inflammation situations. So it's very important to get that obesity down or get our overweight down and reduce excessive weight could be very helpful for your immune system, for example. Second thing is symptoms, like what I was saying earlier. If you got lower back pain, let's fix it. If you got neck pain, let's take care of it. You got headache, let's take care of it. Don't let things drag on. And one of the things that is very important is to manage hypertension. I have noticed that a lot of my patients, their hypertension may not necessarily be well managed. There are some patients who it's not even the drugs or herbs that they take. They have hypertension and they don't even know it, or they don't even do anything about it. And that's quite dangerous, not just in the sense of stroke situation, heart attack situation, but also that it burdens on the body and it can create other issues also as well. And also that when you are diseased, when you have like hypercholesterolemia, you have high blood pressure, or you have diabetes. What happens is that when you get sick, you get sicker than other people who don't have these conditions. You become a drag on the body. Okay. So a lot of times, this is where we see people, like, for example, in COVID-19, we see people die or having issues, have to go on ventilator because they have some pre-existing conditions that
Right.
was not well managed.
So I think this is an important thing to stay on for a second, particularly because it's an important topic. And then just in the environment we're in right now with COVID and stress, I think people are probably having hypertension because of that they never would have had before, right? Being home or having to homeschool, or maybe they're out of work, or maybe they've spent too much time with their spouse. And I'm laughing as I say that. Not trying to be funny, just trying to be real.
You are trying to be funny.
You know, and I think hypertension is definitely a real thing, right? Depending on, and you said, like, some people don't even know they have it, right? So let's talk about that for a second, because I think this is a real thing that's happening right now for people and they don't even know. What are some of the symptoms of hypertension?
Well, sometimes it can be asymptomatic, where that you don't see, there's no symptoms to show.
Of hypertension, really?
Yeah, there's sometimes
Okay.
symptoms. But there are sometimes you have symptoms such as dizziness, all right, such as losing balance, such as headaches, all right, and such as eye fatigue. Some of these symptoms can be a sign of hypertension. Now, there are risk factors to hypertension, even if you don't have symptoms. For example, obesity. If you're overweight, there's a more likelihood you're going to have hypertension. So, for example, when my patients are overweight or they gain weight, I usually like to take a blood pressure to make sure that I'm not missing the hypertension side of it. So those are kind of things that I would do. And also, if you sit there on a Zoom session all the time, whole day long, like what we're doing these days, you know, I call them zombies. So if we become zombies, what's going to happen is that, you know, you're going to have higher blood pressure because you're not moving around. Blood flow is not as good. And so the vascular pressure is going to increase, and therefore you're going to have hypertension. So these are kind of issues that we have to be careful with these days when we are doing stay-at-home type of work.
So what are some foods, for example, that reduce hypertension and also boost your immunity?
Well, a lot of times, all usually your vegetables, okay? Your green leafy vegetables do help with blood pressure and do help with strengthening immune system. For example, celery. For example, cilantro. For example, cucumber. For example, bok choy, cabbages. All these things has tremendous amount of vitamin C, and they have very good fiber as well as chlorophyll that is very helpful for your immune system. And so I would say vegetable will come first. Drinking a lot of water can be helpful too. And, you know, it doesn't have to limit to vegetables, but it's very important to be careful with heavy meats because they can increase your cholesterol and increase your blood pressure. So these are kind of things you want to be careful. So if you do want to eat flesh or meat, then I'd rather you eat some fish. That actually would be benign and much helpful for your blood vessel, much helpful to avoid clogging up your arteries.
And Dr. Dow, do you have a preference? And I know for women this can vary depending on time of the month, depending on age. And do you have a preference of eating vegetables warm or juicing? Again, it varies different for women.
I think it depends on your constitution. Some people do very, very well with juicing, and some people get a lot of bloating and gas with juicing. So if you're a type of person who gets a lot of gas with juicing, then go ahead and do some soups. You know, the soup can go down easy and much easier on your digestion, for example.
Okay. Yeah. So then as we continue to talk about immunity, let's talk about acupuncture and Chinese herbs and how you help support the patients that you see either in the office or with telemedicine. How are you supporting them with their immune response?
Well, first of all, let's talk about acupuncture. There are points, for example, this point Hegu, that's right on the palm, right between the thumb and the index finger in the web here. Very helpful for immune system, very helpful for actual disease of a cold or flu, even when we use for headaches, for example. We have used for fever, we have used for cough, for example. So we use some of these points also as a preventive also as well. Stomach 36 on your leg area. I cannot bring my leg up for you to show you, but it's on the outer side of your leg and just right below your knee. We call it stomach 36 or 足三里. And that point is very useful, very powerful for stimulating and raising your immune system to help you to fight diseases, for example. And there are many other points. This is not just these 2 points. I'm just giving you an example that you can use, and your acupuncturist will select the point, the cohort that will work the best for your body. And it also depends on what's going on at a time. You might be coming in with a headache, you might be coming with a sinus congestion. And so we have to address and deal with that, for example. So a certain points will be selected for that. Let's talk about herbs. Herbs is, oh my God, there's about 5,700 different kind of Chinese herbs for different purposes. In the antibacterial, antiviral category, you're talking about these easily commonly used somewhere between 100 to 300 different herbs that you can use for that. Okay.
Wow.
So it's a big repertoire, and they need to be combined together to give you the best bang. I mean, when they work together, they work very well together. So that's the reason why Chinese herb tends to be combined together. We tend to not use like singular herb. Like for example, you talk about elderberry. Okay, that's a Western herb. A lot in Western herb, we just use like elderberry, one type. In Chinese medicine, you might be using noni sera for CTI. You might be using indigo plant, all combined together, maybe anywhere from 7 to 12 herbs combined together, for example. Because synergistically, when you combine them together, it tends to amplify their action and functions. It becomes so much more powerful. Dealing with sore throats and dealing with whatever symptom or flu-like symptom this patient might have.
So while we haven't been seeing anyone at the office that's positive for COVID-19, you have been supporting people that have tested positive with telemedicine, and we've been mailing them herbs. I think since we're on this topic, it would be great to share with everyone the results that you've seen in supporting people with their immune system as they fight COVID-19.
So far, I have documented around 10 to 11 patients, and especially at the beginning of a COVID-19 infections, that we have did telemedicine, phone consult on these patients. These patients, most of them has symptoms of fever, symptoms of cough, symptoms of shortness of breath. Those are the kind of the three most, shall we say, most common symptoms. There are some minor symptoms, such as tingling of the hands or feet, symptoms such as loss of smell or taste. That doesn't come at the beginning. It usually comes much later, or shall we say residual symptoms. So we've been sending herb out and touch wood. Most of our patient has done extremely well, except one patient or two patients. None of them have to go to hospital and stay overnight, and they basically recover while they're at home. So that is the active infection state ones. And then I have some patients, there's about 2 or 3 patients I'm treating right now who is post-infection, who had infection 2 to 3 months ago. They no longer are infected with the virus. They already have developed a nice, robust antibodies, and their body basically doing well, but they have some residual symptom that they could not shake. All three of them has tingling of their hands and feet. They have a little bit of sternum pain, shortness of breath, as well as loss of taste or smell. So these are some of the most common symptoms. And then fatigue, obviously fatigue. These are some of the common post COVID-19 symptoms that we have seen in these three patients. Of course, it's a low number. We're not talking about a large number. And all three of them is doing well. Overall, that their symptoms has subsided or reduced. One thing that I found to be very interesting is that I have a patient whose symptom gets better and then comes back a little bit. Gets better, comes back a little. It's almost kind of like reminder, I'm here, kind of thing. And it doesn't really, it's not pathological. It doesn't create a problem for the patient, but it's annoying. I mean, we really would rather have some of these symptoms to go away.
Yeah, absolutely. Well, I think it's just important to talk about it because I know it's something that you and Dr. Mao, your brother, have both been helping support patients with, over the phone and supporting them virtually and mailing herbs. And you both have seen tremendous progress. And I, not to speak for you, but learning a lot about COVID, and I think continuing to learn about immunity and what works and what doesn't. And, and it's obviously different for everybody depending on our genetic makeup and our body's strength and weaknesses, correct?
Yes. Yeah. And also, I mean, we may want to talk about things like autoimmune diseases, which is the other side of spectrum, where our body, for whatever reason, becomes hypervigilant and start to attack our body. For example, Hashimoto thyroiditis. That's sometimes we call it autoimmune thyroiditis situation. That is a thyroid inflammation, but it's an autoimmune kind of disease. Other autoimmune disease such as rheumatoid arthritis, for example, such as things like Sjogren syndromes, things like multiple sclerosis is known to be an autoimmune disease, for example. So there's quite a bit of different autoimmune diseases that we come across and we treat. We're trying to manage symptoms. And some of them requires infusions of biologic medicine. And some of them are mild enough. If we get to them early enough, we might be able to reduce the progressivity of the disease itself. And these are autoimmune diseases where our immune system's hypervigilant, and that has been creating issues for our body. So for example, and a lot of time, I remember when I was doing my residency in Dongzhimen Hospital in China during the time of basically hematology and oncology. I remember our teacher at the time really discussed about how some of the leukemia cases, lymphoma cases, some of the blood oncology cases can be due to virus. Okay, some of the suspicions that the virus can actually cause dysfunctional immune system and cause our immune system to be hypervigilant, duplicating immature cells, for example. That's an oncological issue, or that is trying to attack our tissues, attack our organs vigorously, and causing damages. And so, for example, Lyme disease, for example, when you have a bacterial infection and stimulate your body's immune system to attack itself. And while the Lyme disease may be gone, but your body is still in that attacking mode, for example. And that could be an issue.
Very interesting. Definitely. I know another common question that comes up sometimes is, there's some people out there that are, for example, always cold.
Mm-hmm.
And they think because they're cold, like, does that mean that, I'm perhaps more susceptible to getting sick, you know, because some people are just cold all the time. Like
Yeah.
everybody else is running warm and this person's cold. So what can you, I mean, it may seem like a silly topic, but I think it's something that.
Absolutely not. If you have aversion to cold,
Mm-hmm.
it shows easily. It tells me that your thermal regulation of your body is poor. And it
Mm-hmm.
can be many different reasons. One of the reasons is that blood supply. You may not be having enough blood supply. Your blood flow may not be as good. You might be anemic. You might be low blood pressure or too low. You
Okay.
might be low blood sugar, for example. So there are many reasons for this situation of poor circulation. So in a situation of aversion to cold, then when you have a poor thermal regulation, our body has to be at a certain temperature for us to be functioning the most efficient. So when our body temperature goes below a certain temperature, we get sick very easily. Okay. So obviously there are outliers. There are people who can survive with low temperature. But in general, if our body temperature is not in that range of zone, that's appropriate optimal zone, then our body, it's not able to fight disease as well.
Okay, good to know, because I think that that's something that comes up a lot, right?
Yes, it does.
Um,
And it's very interesting. I mean, you know, I have patients who have hot flashes or night sweats.
mm-hmm.
And you imagine if you have hot flashes, night sweats, your temperature is going to be high. And it's true, some people it's going to have high temperature, but actually quite a bit of them are actually lower temperature than their norm. It's almost like when the temperature dips, that's when they actually start to feel flushes upward. And so it's very interesting what you feel, and the actual temperature may not be
Mm-hmm.
the same.
It's so interesting.
Yes, it is.
um, so I want to talk also, we talked a little bit about exercise earlier, and I think we know from you and other webinars that we've done that exercise is important for the immune system. But oftentimes there's a question for a lot of people about whether or not exercise is good when you're sick, and or what type of exercise is good. And I know you actually, you have even shared this with me in regards to COVID patients. And I know that you have actually asked people to get out and even do light walks, even with being COVID positive, to help keep things moving. So what can you share with us about even being sick, and the immune system and exercise?
First of all, of course, these are very special cases. These are people, I often tell them to be able to walk around their house so that they don't pass their germs to other people. So if they live alone, that's appropriate to do. I think it's very important to understand when you're sick, it's often rest is probably the best recipe. But you get to a certain point where rest does not help as much. You need to move around and get your circulation going, especially with COVID-19, where we now know that there is clotting issues. Therefore, we don't always want people to always just sit there or lie there all the time. We want them to move a little bit more. Okay, so coming back to this, exercise is appropriate on a regular basis. If you're healthy, you should be exercising regularly every single day. It should be an every single day phenomenon. Half hour to 1 hour of a good, moderate to vigorous exercise could be very helpful for your health. Okay, so that's the first thing. Second thing, your question is, if you're sick, should you exercise? I think it depends on your sickness. In general, as a rule of thumb, when you're sick and when you do feel sick, you probably shouldn't exercise, okay? Especially at the very beginning until your body start to recover and start to heal. So that's what I would suggest people do, is just lay off exercise when you're sick, allow your body to rest. Sometimes your body gets sick because actually it's a way to force you to rest. It's like,
Mm-hmm.
okay, doing too much, you need to go to bed, okay? So sometimes, you know, sometimes when I do get sick and if I get to that kind of sickness and I'm tired, I just go to sleep, you know, just stop working and go to bed because my body's telling me this is what you're gonna have to do and you better listen. Yeah.
Yeah, we do have to pay attention. It does tell us. We just have to be paying attention.
We'll always like to hear it.
Dr. Dow, what else would you like to share with us tonight about immunity and, good or bad as we start to wrap up?
We have a flu season coming this winter. I think it's important to be vigilant. While we have a COVID-19 pandemic, it complicates things more. And while our vaccine is not even ready yet, there's a potential that the flu season can be a bad one. I think it's very important for us to continue to practice, and we know now face masks do work, do reduce the spread of the virus. I don't care how you say it, I don't care whether or not you're against it, scientific evidence does show that it reduces transmission. So it's very important when you're in a crowded place, very important when you're in a situation where you're in the general public space, it's important to wear a mask if you can. That's a key because you don't want to get it and you don't want to spread at the same time. So that's number one, is face mask. The other is physical distance. We are still in a pandemic time, the last time I checked. So I think it's very important for us to still adhere physical distance, okay? Does not mean that you cannot go to work. It does not mean that you cannot be careful, and being careful in the sense of working with a physical distance and having fresh air. There's a lot of things that you can do to minimize and reduce the risk, not just COVID-19, but also reduce the flu. I think if we can really adhere to face masking, adhere to physical distancing, I think that's going to help us in the area of transmission. Now, the other part is really to strengthen your body. All right. You don't know whether or not you're going to get exposed or you're going to get sick, whether or not it's going to be flu or cold or viruses. It's just very important to really look at your everyday lifestyle. Look at in the sense of getting enough sleep. Remember I talked about that, the stress level, and as well as your diet, the sweets and the alcohol, reducing of them. And that should be an everyday phenomenon. If you can try to keep your health pretty regularly good, then the sickness, even if you do get sick, the sickness is going to be much, much milder.
I want to ask one more question because I know that we are in September and stress is building for people, right? We've been home since March. People's lives have changed significantly in more ways than I could even give examples. And I don't know, none of us can predict when it's going to get easier. And as you mentioned, we're going into flu season and things like that. Like there's other things ahead of us. And I just want to ask you to share a little bit about the mind is so powerful. And I know that you and Dr. Mao focus a lot on meditation. And I would love for you to share how meditation and strengthening our minds can help our immune system.
I think that's crucial, and you hit on the spot of mental health. This is a very difficult time for most people in the world with COVID-19. We have reduced social contact. You don't even hug people as much. You don't even kiss people as much. It's been a very difficult time for a lot of people. And this is really a training about resiliency. There's no doubt about it. And I think the key here is to really look at how you're feeling. There are times where I feel kind of depressed, which I don't try to allow myself to get there. So I'm busy. First of all, I'm busy. And when I'm not busy seeing patients, I am basically outdoors. I'm in nature. Well, right now with fire, it's really annoying right now. This is a very difficult time in California. But when it's possible, I'm basically hiking a mountain. I'm right by the ocean, walking the surf, getting that negative ion, that good energy into my body. And every time when I take a good walk, every time I take a good hike, my energy improves. I feel so much better. Okay. And there are times where I could cry. You know, I think about the stress that it goes. It's almost like I have a little bit of reaction, just kind of cries out, letting all the stuff come out, letting all the stress come out. And then don't forget, you can also call somebody. Okay. If you feel kind of stuck, you feel depressed, call somebody. You know, we have a lot of phones. Make that phone call. We can even do Zoom section. We can do video. We can do audio. You know, call out somebody. Call your friends. Chat with your people. And so physical distance does not mean social distance. Okay, so I think it's very important to do so. My focus right now in my life is I'm trying to focus on taking care of my patients. It's been a very difficult and tumultuous time for a lot of my patients, and I have to be there for them to help them to really move on and keep strong with their mental health. And that's very important. I've seen an uptick in depression, uptick in anxiety, and so using acupuncture to help them to reduce that really help their immune system to stay strong so that they can fight disease better.
Well, Dr. Dao, I appreciate you just even being vulnerable yourself and sharing that it's been hard for you as well. I think people need to know they're not alone, and that even someone like yourself, who is so healthy and intelligent, and you're so well respected and you take such good care of yourself, and yet you are experiencing, you know, some struggles as well. So thank you for sharing that with everyone. I think it's important.
No problem. I think we are with this together. And I think we need to be here holding hands virtually and helping each other to move forward. This is how we can beat this disease. This is not the first time we deal with a pandemic. It won't be the last time. But every pandemic really tests our resolve as a global community. The only way we can beat this is come together, get better at working together so that we can beat this together. We can't do it alone. You cannot.
Nope.
You have to do it together.
Yep, I couldn't agree more. Thank you so much for your time tonight, once again, for your candor, for your commitment to everyone. It's so appreciated, and I look forward to seeing you soon, and I look forward to next month. So thank you.
Thank you so much, and you stay safe and healthy.
You
and
too.
I will talk to you soon, and I want to wish everybody online to be healthy as well as to be safe. And I want to wish you all well and healthy also as well. I'll talk to you later. Thank you.
Thank you, Dr. Dao. Have a wonderful night.
Okay, bye-bye.
Bye.